Hi, my name is Leslie Bronner, and I will be giving a presentation on improving access to mental health care in rural populations, specifically examining the acceptability of telepsychiatry in a rural community mental health care clinic. The National Alliance on Mental Health and the New Freedom Commission on Mental Health has acknowledged a pressing health care goal to improve access to care to quality mental health services to rural populations. Rural dwellers are grossly underserved and face many disparities in mental health care treatment when compared to their urban counterparts. Due to stressors such as poverty, limited access to services, and scarcity of resources, these patients often have poorer outcomes overall. Research has shown that rates of psychiatric illness, suicide, and psychiatric hospitalizations are higher in geographically isolated areas. With 85% of rural areas being labeled as a mental health professional shortage area, mental health organizations are constantly looking for solutions to address the ongoing needs of this particular population. Telepsychiatry has been proposed as a potential solution. Telepsychiatry is a health delivery service model that uses video conferencing technology to provide psychiatric services to patients. This concept is particularly useful for areas where psychiatric services are not readily accessible. The current literature shows that telepsychiatry produces outcomes that are similar to face-to-face care. In addition, telepsychiatry can be used to improve availability, accessibility, and overall quality of mental health care. One uncertainty remains, and that's whether patients find telepsychiatry to be an acceptable alternative to traditional care. In short, if we offer it, will these rural patients actually use it? The purpose of my DNP Capstone project is to study the acceptability of telepsychiatry through implementation of a pilot study in an existing rural community mental health clinic. The objectives are to introduce the modality to the rural population, assess patient satisfaction and acceptability, and evaluate the outcomes of an implementation program to estimate the probability of success on a larger scale. 5 studies were reviewed and included in a comprehensive literature review to examine the acceptability and patient satisfaction to the use of telepsychiatry and telehealth. Rowland, 2001, performed a longitudinal intervention study that evaluated the acceptability of telepsychiatry to rural populations specifically. This study provided an intervention that is the most similar to my proposed Capstone project. The results were encouraging. The investigator found that telepsychiatry was rated higher than traditional care in the domains of convenience, ease, attention giving, and time spent, and she concluded that telemedicine provides an adequate alternative delivery model. A second study by Greenwood, Chamberlain, and Parker in 2004 showed similar conclusions, with 90% of the patients in the study satisfied with telepsychiatry and 80% of the patients indicating that they would likely use the service again in the future. 2 studies measured patient acceptability with telemedicine between an urban and rural population subgroups. Satisfaction was significantly higher for the rural populations in the study by Hilty 2007, while the study by Gruball in 2008 found that both rural and urban groups indicated a comparable preference for the 2 modalities. In conclusion, all of the studies reviewed found satisfaction was relatively high for the various target populations. While it has not been found to be superior to traditional care, telepsychiatry is generally regarded as an acceptable alternative. The Capstone project that I am proposing aims to examine acceptability and satisfaction with telepsychiatry in a rural Kentucky population. The program implementation will take place at the Brandenburg Community Care Clinic in Meade County, Kentucky. Meade County is a rural area with the nearest city approximately 30 miles away. There is currently only 1 medication provider and approximately 12 therapists to serve the entire psychiatric needs of the community. The agency is a designated community mental health care center that receives state and federal funding to provide services to the underserved and uninsured. This setting was chosen for the implementation project because it faces the unique challenges of rural mental health care delivery, including problems with access to care, frequent turnover in providers, lack of resources, and high acuity of patients. The target population for this study will be adult patients of CommuniCare that are residents of Meade County, Kentucky, and have an established Axis I psychiatric diagnosis. The main persons involved in this study will be the patients or the subjects, the primary investigator, the Kentucky Telehealth Network to approve the equipment and ensure confidentiality and HIPAA regulation, and the Director of Information Technology to manage the use of equipment for the session, such as securing the network lines and transmission quality. The three main objectives for this study are to introduce the concept of telepsychiatry to a rural population, assess patient satisfaction using the Telemedicine Satisfaction and Usefulness questionnaire, and evaluate the outcomes of implementation. Patients that are unaware of telepsychiatry may inquire into the service, which would help facilitate recruitment into the study. 50 subjects that meet inclusion criteria will be chosen. Participants will be prepared for the intervention through the use of a written outline of the project's purpose and methods. Informed consent will also be obtained. The subjects will be offered a telepsychiatry session that will be conducted in a similar format as traditional face-to-face care, with a structured interview and medication consultation. The session will follow all HIPAA regulations and be delivered on a secure, high-bandwidth connection, allowing for clarity of audio and visual components and limited delay in transmission. Following the session, subjects will be able to complete the Telemedicine Satisfaction and Usefulness Survey. Responses from this survey will be analyzed to evaluate outcomes and make predictions about the success of telepsychiatry on a larger scale. Data collected will be stored confidentially and reviewed by the primary investigator. The TSUQ questionnaire has been chosen as the instrument of choice to use for this capstone project because it was found to have acceptable construct validity and internal consistency and reliability measures. The Chromebox alpha reported for this instrument was 0.96 for the video visit and 0.92 for impact and use. Following completion of the intervention and questionnaire, the demographic and questionnaire data will undergo statistical analyses using descriptive and inferential statistics, including measures of central tendency, frequency, and chi-square analysis, to draw conclusions on the acceptability and satisfaction with telepsychiatry. If telepsychiatry is found to be satisfactory to the study population, it may begin to be used more regularly in the clinic to improve delivery for Meade County. It may also be adopted by the CommuniCare organization as a whole to be used within the 8 clinics that serve the surrounding rural counties, making one small step towards improving the quality of life for rural patients overall. Thank you.